Hello! Welcome back to Metropolis. My name is Calden Datsimpa. And today, I have a guest. A public nurse. Not just a public nurse. Sasha Dyck is a public health nurse in Parc-Extension. He is involved in various neighborhood projects there involving food security, tenants' rights, and local schools. He ran for municipal office in 2013 and has coordinated several election campaigns since then at all levels. He has 2 kids and enjoys the outdoors. What do you like most about the outdoors?
I just love a good winter's day when it's like a solid -10, like today. None of this -3 and raining, +5. Forget about it. Give me -10, -15. It's too cold for snow, too cold for wind, too cold for clouds.
Yeah.
You can see for miles. And like today at lunch, I went cross-country skiing in Jerry Park.
Lovely.
And it was gorgeous.
Lovely park, fantastic park. One of the best parks in Montreal. People
Celebrating 100 years this year.
Oh, Jerry Park?
Jerry Park.
Hey.
This is a great story, actually. It was 2
Happy
brothers,
birthday.
the Jerry brothers, who were not related to the original Jerry, whose name was taken by the street. So Jerry Street and Jerry Park, 2 different families, a couple hundred years
really
apart.
interesting,
Yeah. So there's a city councilor, and his brother was a physician. And it was back when there were all these pandemics in Montreal. And the physician was like, you know what people need? He told his brother, they need open air.
Mm-hmm.
Fresh air, green space.
Mm-hmm.
We should make a park. And so his brother went to the Bag family of Bag Street down in the plateau because they owned Jerry Park. It was where they kept animals. And so they rented it for, I think, 5 years. It was kind of a projet pilote, test pilot.
Mm-hmm.
And people loved it. And so then the city bought the land and turned it into a park. And then it got the name of Raoul Jarry and his brother, the physician. Isn't that a great story? 100 years ago.
I love that they had the same names as the street, but just unrelated.
They might have been distantly related, but it was definitely like a couple hundred years later.
Oh, that's actually interesting. I love that kind of history stuff. Thank you for that.
You're welcome. I used to be on the board of the Friends of Jerry Park, so I'm a big fan.
Nice, yeah. Yeah, I think I also appreciate a nice winter day. Like, -10 is nice, but I love like a real, I mean, not for the whole winter, but I love a good like -20, -30 day.
Yeah.
Because it's just humbling, you know, you're just outside and you're like, ooh, I'm small. I'm very fragile. My human flesh does not like the biting wind. And then I also find what makes the Montreal summer so nice is that the winters are so cold and brutal here. But I don't have you here talking about the weather. Actually, but I will have you talk about the season.
Sure.
Because it's flu season. People are getting sick.
It is. Today I got the memo. We are officially in a flu pandemic.
Wow.
The numbers are now high enough because, of course, everybody gets together over the holidays.
Mm-hmm.
They're indoors. They're mixing. They're transmitting. And then 10 to 14 days later, boom. So here we are. Interestingly, though, we're probably like 10 days behind last year. So it's a little later.
Okay.
But the slope is the same. The numbers are going up. It's not too late to go get a flu vaccine.
Mm-hmm.
It will take a little while to kick in, depending on your immune system, but it's worth it. Come and see me.
Go and see Sasha.
I'm at Jean Talon and Park Avenue, 7101 Park Avenue. Ask for me. I'll be happy to give you this year's flu vaccine.
Yeah. What else are we seeing right now? I see a lot of news about measles outbreaks as well.
Yes. It is a damn shame. I don't know if I can curse on this show, but
You can.
we haven't had measles in Canada since like 1998. Like we have 30 or 40 cases a year that come in from other countries, travelers who have measles, but it never goes anywhere because we have an over 95% vaccination rate of people who have measles. So the person walks around and it's okay. People are mostly protected. It doesn't transmit. Last year we had the first cases of community transmission in Canada, here in Quebec, sadly, but also then in Ontario. And this year we're off to a bad start because somebody came for that NATO summit in Montreal and spent a lot of time enjoying our wonderful city. Even went to some clinics because wasn't feeling well, but wasn't caught in time. Ended up spreading a bunch of measles. Now we have 11 people who also have tested positive for measles. In Montreal and in Laval and the Laurentides now, because these people are geographically dispersed. And this is the most contagious disease known to humankind. For every person who has measles, on average, they're going to infect 17 other people. And then each of those goes and infects 17. So you can just imagine,
spreads.
And all of this because we're behind on vaccination because of the pandemic. Lots of kids didn't get their vaccines. People, especially in the States, we see lots of spread because people are like, do I really need to get it? Other people have it. They assume that They're going to be part of that 5% instead of the 95. And so we're getting more and more of these outbreaks. Anyway, it's a real shame because the people who are going to end up dying from it are the very young and the elderly and the infirm. And we have a great vaccine. So if you're unsure whether or not you need a rougeole, a measles vaccine, come and see me. We'll talk about it while you get your flu vaccine.
Get your drugs.
Yeah.
Well, I'm kind of wondering, how do you deal with these kinds of outbreaks at the clinic?
Well, we haven't had an outbreak at the clinic. As far as we know, that person did not come to see us.
But do you like prepare for it? If someone comes in, what do you do? What happens?
Well, this is probably good for everybody to know. The three things that you'd want to see that would really be like a red light, like, oh man, maybe measles, are a fever, watery eyes and watery nose, and so the characteristic kind of looks like chicken pox, the red spots, probably starting on the forehead and on the neck. Once you have, you look okay. Once you have those three, and especially if interestingly, photophobia. So being afraid of the light. Somebody wearing dark glasses, just being like, I don't know. It's
kind of like a hangover.
There you go. Boy, if you've got those four, then at that point you're putting an N95 on that person. You're putting them on the back porch. Like, don't get in my house. Yeah. Call 811 right away, and they're going to put you through to an infectious disease specialist. And probably this person's going to be brought to the hospital, brought directly to a negative isolation room, negative pressure room, and treated for measles.
Wow.
Yeah.
So and you're saying it's really interesting because you're saying that there's more. You're behind on that. We're
still playing catch up. There were lots of kids. Well, because the clinics were closed. It was only for emergencies, so people weren't just doing the regular 6, 12, 18-month vaccinations of their kids that they usually do. Usually we give 2 doses at 12 and at 18 months, and then once you have 2 doses as a child, you're not going to get measles. It's a very effective vaccine. Or if you do, it's going to be not very contagious, not going to last very long. It's not a real issue.
This current measles outbreak, then you would connect that to sort of like the COVID shutdown and like how
absolutely
paused since then. Wow.
Yeah, and in general, we're still playing catch up on vaccination. And then in addition to that, a lot of people have made a lot of money creating, fear and uncertainty and doubt around vaccines in general. So sometimes we go into the community, we do a pop-up vaccination clinic, and then we tell people, hey, we're doing vaccines. And they say, no, I don't want to hear about it. It's all 5G, Bill Gates, oublie ça. Yeah. And it's a shame because no matter how you feel about COVID vaccines, which have saved millions of lives, the measles vaccine is an excellent vaccine. It is really worth saving it's going to save your baby's life.
No one was
Get
really
the vaccine.
Doubting measles vaccines.
No, or tetanus, Interestingly, sometimes you get people, they come and they're like, I don't want that COVID, crap, but give me the flu vaccine. It's like, okay, how does that work?
In there about that's interesting. What do you account for that kind of increase in
well, I think a certain amount of just like scientific illiteracy. Also, it's been so long since we saw measles. I've never seen a case of measles myself. I've read about it, but we haven't had one in Canada since 1998. Right. We haven't had, whooping cough, polio. There's a whole generation of people who grew up in the 40s and 50s, and like 1 out of every kid in the class probably had polio at some point. And sometimes it's permanently disabled and disfigured. And now we've just forgotten this. Right? Exactly.
I feel like I always see that thing about people who got the polio shot. They have the indent or something like that.
The earlier polio shots were actually scarification. So they actually made a little scar and kind of got the vaccine in there. It's
old school.
It's old school. And smallpox too. So
So I guess now we're seeing, because of COVID, you're saying that there's this kind of dent that's been made in just the general
overall vaccination rates are down just because people couldn't access them. And then also, unfortunately, when you do polling, the polls show that overall vaccine confidence is also down.
Interesting.
Wow. And yet the science shows that vaccines are like the number one health intervention from the last 100 years. It's just saved hundreds of millions of lives of people who otherwise, these are babies who wouldn't have made it to their first year.
Of course, yeah. How often do you run into the kind of vaccine hesitant people in Parc-Ex?
In Parc-Ex, it was very interesting how Parc-Ex, in general, I love my neighborhood, but often people aren't paying attention to local news. They're not speaking English or French. They're not watching CTV News or reading Le Devoir. They're watching the cricket and they're watching the Greek football game, and so their news is almost more from back home. And so it's interesting how international events can have local effects. So, for example, vaccination was actually really struggling, and just reaching people was difficult. And then COVID took off in India, and boy, everybody was lining up to get the vaccine, because all of a sudden they saw, I mean, in Delhi, they had like piles of bodies in the streets that they were burning. It's just horrific stuff. And so people say, oh, okay, yeah, this is real. I should get the vaccine. Conversely, the old Greeks, there were many overtures made by Trump towards the Greek community, and they really fell for this guy. They love him. And then all of a sudden it was like, yeah, you know what? Trump's not too sure about these vaccines. Maybe I'm not too sure either. So... yeah, it's interesting how international stuff plays out locally.
Yeah. I mean, I was talking to Drew about this on our last episode, but we were talking about sort of the decline of local news, right? Yeah. That kind of coverage and the reach it used to be able to have, and just the capacities that a lot of these like local papers, local desks had for reporting, right? And to me, that seems absolutely like intimately connected to this kind of thing, right? Where like, of course, people are working more, and maybe they weren't reading much like local news in the first place. But the fact that like local news has such a smaller footprint. It's like what takes it up is that whatever people's like international media diets, or like sort of connecting to news back home. I think it's so fascinating that is the first, I guess, I don't know, inclination of what to watch, what kind of media to consume over local news. Yeah.
Well, you still see the satellite dishes, up and down Acadie.
Yeah. Every time I'm in Parc-Ex, I always see it's like there should be like a photo project on this, but I always see the satellite dishes, and very often they're kind of decorated. They're kind of like painted.
Well, some artists got a grant to paint satellite dishes, especially the unused ones, because people don't really want to take them down. It's a hassle, and so everybody's gone to internet stuff. But you still have the dishes, so each one is a different artist, I believe, and they get paid like $100 to go and paint a satellite dish. Yeah, there are some really beautiful satellite dishes in Parc-Ex, lovely painted ones. The trick is to go in the alleys. That's where the most beautiful ones are. If you just stay on the streets, you're gonna see the basic ones go into the alleys.
After you get your measles shot from Sasha,
we'll go for a walking tour.
Yeah.
Get some samosas.
Yeah. Fantastic, wonderful. Let's talk about Parc-Ex. Let's talk about politics in Parc-Ex. I think there's
there's definitely been no news regarding the federal politician for Parc-Extension.
Yeah. So Parc-Extension, part of the Papineau riding, a federal riding. Was Parc-Extension as well as Saint Michel and Villeray, part of the Papineau riding. And who represents the Papineau riding?
Our MP is also the PM, the Honorable Justin Trudeau.
Yeah. Justin Trudeau, I mean, so many people are talking about this, resigning from the prime ministership as the leader of the Liberal Party, and as
well, he's saying he will resign once they choose a new leader. Yeah. And then this afternoon, just a few hours ago, so today's the 15th of January, he announced that he would not be running again in Papineau, which really opens things up. It's going to be an interesting time.
Yeah. What I mean, let's talk a bit about his the tenure of Justin Trudeau in Papineau. What kind of if you as a Parc-Ex resident had to give him
took a lot of pictures. A lot of selfies.
Oh, he did.
Yeah, that's his main legacy, probably.
Of course, yeah. Just coming, he's like, gotta step in the riding, a little selfie.
Exactly.
And then he leaves. Is that it?
Yeah. And he marches down the parade down the middle of Curbs Avenue, on Indian Independence Day, and every block he unbuttons his shirt just a little bit more, and then does a little dance, and then he goes to eat at Marvin's, a Greek restaurant, and then he goes home, and then we'll see him next year. That's it. Life. That's it. Once a year.
Yeah. He's meeting with the constituents. If you as a Parc-Ex resident, a Papineau voter, had to give your MP a grade, what would you give?
Like a C-.
C-. Why? Yeah. Tell me about a C-. So it's not an immediate fail.
I actually needed his help as an MP. This was back when he was just a backbencher. So he wasn't even thinking about the leadership of the Liberal Party. Wasn't thinking about being, in any case, I don't know if he was thinking about it, but he wasn't at that point.
I don't know
what that means. But I have like this interesting, kind of peculiar situation where I'm a Canadian born abroad of a parent who was a Canadian born abroad, and she's the child of a parent of a Canadian born abroad. So I'm like a third generation Canadian born abroad, which isn't a problem until Harper got upset because there were, I think, Lebanese Canadians who were getting bombed under Operation Cast Lead in 2006. So Israel's bombing Lebanon. And so then they went to the Canadian embassy and they were like, help for Canadians. And instead of helping, Harper was like, but are you really? Are you really Canadians? Do you have a real link to this country because you're Canadians born abroad? So Then so he passed a law which now has been undone, like so many of those terrible Harper laws. But and the damage is still there, where if you're a Canadian born abroad and you have a child born abroad, you can't pass down your Canadian citizenship.
Oh.
Yeah. Just
Wow. So
just for fun, just a little.
I was a Canadian citizen under that, so I guess if I was born these days.
Well, just be careful who you shack up with and where you have your kids, I guess. You got to do it on Canadian soil.
We don't need to talk
with a
about
Canadian. I shacked up with a Canadian, fortunately.
Okay.
But I could have had real problems otherwise.
Yeah.
So I went to meet with him because I was like, this is BS. I should meet with my MP. And,
what was that process like?
well, I got like 15 minutes of his time where he was like, yeah. Like, it was a really empathetic thing. He was like, yeah, we're definitely going to do something about this. And then nothing for years. So this is the Trudeau, Marty Lukács.
Foreshadowing.
The CUTV knows Marty Lukács well. And he wrote an entire book called The Trudeau Formula, which is say great things, appeal to everybody, and then just do what you're going to do anyway. And people just remember what you said and how you made them feel, but not actually what you did. And this is the Trudeau formula, and it worked for a long time until it didn't work anymore.
Yeah, absolutely. You say C+? Oh, you say C-, was it?
Yeah, because at the very end, the feds did come through with some funding for our badly needed community center.
Okay.
Yeah. But not, I think it's like 40% of the overall budget, so we still have to go get a lot of money, and it's not clear where we're going to get it. Because we really need a new community center. There's asbestos in the old one. And it belongs to the school board, and they're kicking everybody out. So
they were able to allocate some level of funding, but not...
through the Green and Inclusive Building grant, which is great. And his office helped, and so we were able to get some money.
Okay, well, I'm happy to hear that.
But, it's going to be, we're looking at like a 5 to 10 year timeline before anybody's actually moving in there.
Yeah, of course. I mean, these things, any kind of government stuff, it moves at such a glacial pace. It's always a long, unless, of course, it's like,
But otherwise, I would have given him an F, honestly. And even representation, like important matters like immigration. In Parc-Ex, how many people need help with immigration dossier? If you have a good MP, we would send people from Parc-Extension to go see Mulcair because his office actually took it very seriously, and they would do better representation with Immigration and Refugee Citizenship Canada than Trudeau's office. And he accepted to do it because for a while Papineau actually ended at Jean Talon. So the block between Beaumont and Jean Talon was technically Outremont for some weird historic reason. And so we could say like, hey, they're close, they're Outremont adjacent, and so his office would take on. So I have a bunch of people who got their refugee claims pushed along by him, but Trudeau never did anything.
Wow.
Yeah. Wow. So really a fail at the representation level. Lots of selfies.
Of course, yeah.
Lots of meals,
Photo
lots of
ops.
dancing. Yeah. Actually, not even that many. He would literally come 2 days a year. The Greek Independence Festival, Indian Independence Festival. That's it.
I feel like he does that thing where it's always like after he won the election, he would go to Jerry Metro and make sure everyone sees him shaking hands with people outside Jerry Metro. Yeah. I mean, the first time I saw that, I'll admit, I was like, oh, that's kind of like charming,
Yeah.
But then I guess once you hear about, I guess just how it's all photo ops, that kind of colors it a little differently.
Not very present. Also, he moved his office. It used to be across from Jerry Metro, which is, I think, why it was so easy for him to just go there on Jerry Street. But then we occupied it maybe too many times because it was very easy to occupy. You just kind of, because there were other offices in there, so you'd pretend you're going to the dentist on the third floor or whatever. Exactly, and then jam the door, everybody in, and then shut it down for an hour, make a stink, and then go home. So now, he's in this like bunker on Crémazie where nobody ever goes, and it's very hard to get into. And actually shares a floor with Denis Coderre's old party, or at least they used to when they can afford the rent. I think they can't afford the rent anymore. But
tough times.
I forget what they're called now. I think anyway, Denis Coderre's old party.
Not Ensemble.
Are they Ensemble or are they Movement? I can't remember. They rebranded. I think they were Movement, and then everybody said that doesn't sound very good, like a movement. Like a bowel movement, something like that. Yeah, I think they're Ensemble.
It's Ensemble now. Yeah. I was like, oh, did they change again? Well, I mean, movement. Yeah. Bowel movement, good there. I wanted to ask you something about this is sort of. I mean, this is of course related to healthcare, but with pharmacare sort of coming in, I'm kind of wondering what your thoughts are on that and how you expect it to affect health services at the place you work at.
Thoughts on pharmacare.
It's a big
let's
topic,
start
right?
with. So I was in the Yukon last year. Had a great time working as a public health nurse, and in my free time, I did some lobbying of our Yukon MP. There's exactly one.
A little hobbyist lobbying.
Yeah, just for fun. Actually, I had a great time. I got like on CBC radio, and I had a petition, and I just jumped right in. Yukon has fewer people than all of Parc-Extension. Like, it's just mind blowing.
Yeah.
It's a huge empty space and lovely people who are very willing to engage, but not many of them. So you can get to know people very easily.
So how did your lobbying efforts go?
So, I sat down with him and I was like,
You bring them to like swanky bars, like expensive suites at
there
hotels.
are no swanky bars in Whitehorse. No, we just like had a Zoom call and so this is what I told him. These are our talking points. Canada is the only OECD country with a functioning socialized healthcare system, so not counting the US, that doesn't include medicines as part of their healthcare. It's ridiculous. Mm-hmm. And as a result, we pay more than anybody else, including the US, for medicines. And it's the fastest growing proportion of the healthcare budgets for every province. And it's just a medicine. Yeah. And it's a gift that we've given to Big Pharma, who are very organized, like all the other Canadian oligopolies. So, it originally, Tommy Douglas said, always intended to bring medicines in, kind of never got around to it. So this is really a realization of like, what is that, an 80-year-old dream or something like that? Yeah.
I feel like it's been decades that pharmacare has sort of been in the discussions and like around.
Sure. Yeah, the Liberals love to bandy it about and send it to committee for study. And in the meantime, I mean, they're clearly in the pockets of Big Pharma. And Canada is called RX&D, although they've rebranded another Essential Medicines Canada, the lobby group for Big Pharma.
Wow.
And you talk about fear, uncertainty, and doubt. It's, you're not going to be able to get your medicines and kind of like death panel stuff in the U.S. where, it's just going to be awful and everybody's going to die and nobody's going to be able to afford anything. And then we won't have the money to invest in all our innovative medicines. But like, they're not investing in innovative. They're just buying patents from on the cheap from researchers who are doing the primary research in university labs, and in research institutes. So the public is funding this research, and then it's being given over to the private sector, and then they're making money hand over fist. So it's very, very frustrating. So that's the current situation in Canada. It has been studied to death. There's so many commissions and expert panels. Everybody knows that we need to simply have a universal single-payer public system for pharmacare. So that means it covers everybody. And then you pay for it progressively through your taxes, just like healthcare is supposed to be. Exactly. And single-payer makes it interesting because even though healthcare is a provincial responsibility, if the feds get together and buy in bulk, it's the Costco effect, My buddy Nick loves
economies of scale.
Yeah, exactly. So we get the Costco effect. All of a sudden, you're buying Tylenol, not just PEI, like, I would like 2 Tylenol, please, And then Ontario's like, I will take 100. Well, let's get 102. We're going to get a much better deal. Of course, and in fact, let's buy it as a whole country. That's when you start making huge savings. So the savings are estimated at like billions of dollars a year on year one.
It's a huge economic argument then in favor of it.
It seems like it would cost more, but you actually end up saving money.
Right.
The money comes from Big Pharma that don't get their incredible profits.
And so what do you feel? Is what we're getting in this pharmacare deal sort of that, or is it sort of? I've been.
Yeah. So
I understand
it is single payer.
Okay.
It's single payer. The bones of it are good. The structure, the infrastructure of the agreement is good, of the law that was passed. Single payer, universal. All of that is great. However, it only starts with 2 classes of medications, and I think this was very savvy on the Liberals' end. They knew that they couldn't pay for all medications up front. Finance Minister Chrystia Freeland was like, that's going to break the bank. We don't have money to just start paying for all medications. So we're phase in, and we'll start with ones that would be extremely unpopular for another government to take away. So contraception and diabetes medication. This is an issue that touches so many Canadians, and I think that was actually politically probably pretty savvy to start with those. I think Pierre Poilievre would have a very hard time taking away contraception, and so many seniors relying on or looking forward to paying the real cost of insulin for their diabetes, which is like really just cents on the dollar. It's ridiculous how much of a markup there is on insulin. Insulin, which was created right here in Montreal by Frederick Banting and then given to the world.
For free. Right?
Exactly. It's ridiculous. Any case. So they started with those 2. And then the idea, which reminds me of like Tommy Douglas, like, someday we'll bring drugs in. Well, the idea is that someday then we'll bring the rest of the formulary, which is what is called the list of medications, would be brought in and into this national plan. But they're starting with the list from BC because BC went first for contraception, and so there's already an established list. So all of those are going to be free, which is great. But we need all medications to be free. So, it's the first step. I don't think it's going to happen under conservative government, but at least it's a small gain that we got from this liberal NDP coalition.
It's a real positive.
And the impact it's going to have on the ground, like, oh my, it's a game changer.
I want to ask you about that on the ground. Like, what do you ever have to, I guess, I don't know, turn away people, or do you ever see people in sort of circumstances where they cannot afford the medication, or how often is it a block, and what do you expect?
Well, especially when you end up in a situation in Quebec, we do have medication insurance. It's actually not very good. It's the worst of all models in many possible ways, but we do have it. But even with the medication insurance we have here, how many times have I talked to seniors and they start telling me all the hacks they have for their medication to make it last? Like this one, I take a half on every other day.
Dystopian.
And then, yes, it's just terrible. And this one, I'm able to get some free samples from my one buddy, the pharmacist every month. He puts a little bit aside, and it's just awful stuff because they simply can't pay for food, housing, and medication. So something's got to go. And usually housing is last because you have to have a roof. So you cut food and you cut medication.
God damn.
Yeah.
That's tough.
You want to talk about housing? It's a segue.
Hey, let's do it. So yeah, pharmacare, good plus, nice to see. It's not the full thing, but
the infrastructure is good, as opposed to dental, which is like a mess. It's just giving money to a private company to manage a means-tested insurance. Like, it's so convoluted.
Right.
Whereas pharmacare, at least the structure is good. The key thing now is just put pressure to make sure that more medications get added to the formulary. Yeah. No. And that's where, unfortunately, things could get political, right? So you get like an advocacy group, like Alzheimer's patients and their families. Oh, this new drug, we really want it. And so all of a sudden it becomes a political thing as to what gets added to a formulary. And you do not want to mix healthcare and politics, especially populist politics like that. So it can get a little distasteful, and hopefully we don't end up going down that route. The people they've put on the committee to suggest additions to the formulary, I have to say, look really solid. But yeah, it'd be a shame if we ended up kind of doing Big Brother for like medications, and turn it into a popularity contest.
Right. No, it's
and who can yell loudest, and
more dystopian as it gets. Housing.
Yeah, what a mess. But
in
Parc-Ex, we have had some gains, mostly because people are fed up and have taken to the streets and have gone to the borough council and city council, and sometimes talking about occupying, just occupied it until they're kicked out. And so we've made it politically untenable to not do anything. And with the law that, to his credit, Coder passed with Couillard, that allowed cities to have a right of first refusal. We've been able to get our borough and our city to exercise that right now 5 times. And so there are 5 lots that were going to be sold probably for awful condos. I was going to use another word, but just awful and inappropriate condos, often very small, low quality, much too expensive.
I've made this point on the show a lot, but I feel a lot of those new condos, I feel like they're kind of like the Scandinavian prisons, right? Where it's all very kind of like clean, but it's just kind of cold.
And it's cheap. It's just gyprock.
Yeah, exactly.
It's fake granite, and they call it condo-style rentals. This is very still condo locatif. It's very and so it looks nice, but nothing actually works. It just breaks as soon as you try and hang it's awful. And the maximum guarantee that a builder has to, by law, offer on a building is 5 years. After 5 years, you're building. I'm walking away. Like, if I build a building that has multiple stories and people are going to live in it, I hope that it's going to last longer than 5 years.
Of course, yeah. Usually, when someone sets up a home, it's not just 5 years, right?
No, and people used to build buildings that they then were going to live in. All these duplexes and triplexes that we love in the plateau.
I know sourdough starters that are older than that, older than 5 years.
And so they were very invested in building quality homes. Today's builders are gonna sell it, walk away in 5 years, not their problem. They can't be sued anymore. And then when you poll new buyers of condos, over half plan on selling it in 5 years. So they have no interest in maintaining it, putting money into the rainy day fund, and so these things often end up not being maintained. And Toronto, is about a generation ahead of us in these terrible steel and glass towers, and they're knocking them down in downtown Toronto to replace them with even larger steel and glass towers because of all the water infiltration, because they never did the maintenance. So.
You're talking about the right of first refusal. You're explaining what.
Yeah, so it means that the city can say, hey, these lots, we're interested in them.
Mm-hmm.
They send an official letter to the owner saying, if you get an offer, you have to tell us. And then we have 30 days to indicate whether or not we're going to match it. And then after that, another 30 days to actually match it. And the law says as long as we can match everything that's in the contract of the prospective seller or buyer that you've signed with. So you said, okay, I'm going to sell to you for $3 million as is. You decontaminate this. You're responsible for blah, 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 whatever. The city can come in, take the exact same contract, just like erase the name, scratch out the name of the buyer and put Ville de Montréal and be like, okay, we're going to pony up the exact same amount and match all the conditions.
So the city was able to buy a few lots?
Five lots.
5 lots in Parc-Extension.
Sitting there, empty, rain-soaked, falling apart, but at least they're off the speculative housing market. And actually the first one, groundbreaking, starts, I believe, this summer for an old paint factory across from Howard Park in northern Parc-Extension. In the middle of the block, all these residences. There was an old Bétonnel paint factory. Don't know how it got there, what it was doing there. It was clear that it needed to go residential. So it's going to be social housing managed by a nonprofit. But the other 4, including the well-known Hutchison Plaza that probably people have heard of. If not, quick Google search away. There you go. Are just sitting there and are suffering because they're not made to have all that water coming in, and then the freezing, the unfreezing.
Right.
I mean, that building was like built as a
stress.
jean factory, so it's very tough. It had very big machinery. It could take a 5th floor. It's structurally sound enough. You could put, it's already 4 floors, but you could put a 5th strong enough. But how many seasons of freeze and thaw can it do? I don't know.
Sorry, go ahead.
Well, we got to come up with a plan for it.
Right, I was just going to ask.
And we got to get the money because the city says, look, we did our part. We bought it. It cost us a fair bit, especially Plaza Hutchison. They paid way more than it became a symbolic thing. They couldn't not buy it. But then they say, well, it's up to the province and the feds to find the money to actually develop the social housing. And they are not interested in doing that. So
it's just sitting there.
So it's just sitting there. Yeah.
Okay, yeah. When how do these housing groups feel about it? What do these housing groups kind of want that you organize with? What do they want done with these properties?
Yeah, we had a public consultation in the neighborhood last month to talk specifically about the plaza, and it was unanimous. We had like 80 people. It was wonderful. Free lunch.
Wow.
Oh yeah, people care about this building because it used to have community groups in it. It had a local radio station. It had a music school. It had various martial arts groups. It had numerous houses of worship on the top floor. And it's a great building. Had the clam that does help people with French classes and write their CV and all that. Anyway, people feel very attached to the plaza. So we had all these people come out, and it was unanimous. Everybody wants it to be 100% social housing. None of this like, 20% social, 20% affordable, which just means 90% of the median rents that for new apartments, which is, so anyway, affordable is not affordable.
Right.
It needs to be social, which is usually 25 to 30% of your take home pay. And we want community groups on the ground floor. So keep it as a community hub. It's right across from Park Metro. Gorgeous location, great building. The old Howick jeans factory, which also is a link to the textile past of the area.
Of course.
Parc-Ex used to be like Chabanel is now, or like the old district down on Saint-Dominique in Mile End. Those were the 3 poles where most of North America's clothing was made, Anyway, now there's only Chabanel left, and there's 1 suit factory in Parc-Extension. So this is what people would like to see with the plaza. Now we've got elections coming up at all 3 levels. It's exciting times.
Next 2 years.
We got to go shake them down for some money and get some promises. Yeah.
About I want to talk about that kind of like building with these community groups, because I feel like that's this kind of constant recurring thing, right? Where I think there's so many of these kinds of like, I don't call them decrepit, but let's say like buildings or properties are sort of like underutilized. It's always the dream to kind of get these up and running for community groups. Like the example I thought of was I used to live in NDG, NDG, you have
The Empress.
The Empress Theater.
Yeah.
It's beautiful. If you haven't been to NDG, it's like right in front of Girard Park. There's a beautiful old like Egyptian revivalist kind of style theater sitting there, and it's like every now and then a mayor's like, a borough mayor's like, I'm going to do something with this. We're going to find funding for it. Sometimes stars get involved. I know Jay Baruchel.
Quote unquote
Montreal.
Stars.
Of course.
I went to high school with them.
No, did you?
Hello,
Montreal
Jay.
Stars. Montreal Stars get involved. Maybe they say they're going to fund some of the project, or they give it some visibility, and then nothing can kind of happen with it, right? I mean, it was one of the goals. It was like revitalize this theater, give some space to like Head and Hands, who ran out of there for a little bit, but then it kind of became an unsafe place to do so. I'm kind of wondering, like, how do you organize around that kind of like trying to get money from the governments for that, right? If they're so like resistant to it, right? Like how do you, because that to me seems like I don't want to like rain on anyone's parade, but it seems like such a huge obstacle.
Was reading about recently the idea of adversarial possession.
Okay.
Squatting.
I'm listening. Oh sure.
But it's a real thing. Quebec recognizes adversarial possession. It has to meet certain clear criteria. Mm-hmm. You can't do it like hiding. You have to be out in the open. You have to maintain the place. You can't just like live there while it falls apart. There are several other things. I am not a lawyer. I'm a public health nurse. But maybe we need to bring back squats. Mm-hmm. Seriously.
Squatters' rights. I've heard about that.
Yes. And in Europe, I mean, I think it's often at the municipal level, but these are real rights that people have in Berlin. Mm-hmm. If you can get a group together and organize and take over an empty building and improve it and live there for, 5-10 years? Mm-hmm. Then you can make a pitch to the municipal government. You're like, this is ours now. This is our plan for it. And they'll be like, great, good for you. Yeah, but in North America, our legal system is built on private property. It's like literally the cornerstone. And as long as you pay your property tax, nobody can force you to do anything that you don't want to do with your building, basically. It's very hard. And so I think wouldn't it be interesting if we brought in some of these European ideas? Montreal often has a foot in both worlds, North American, also European. We don't, we have a different legal system. We have the civil code.
Visit Montreal, they're like, wow, it feels like I'm in Europe.
Yeah, right. Because it didn't.
Now look at the squatters.
It didn't say no right on red. It just said feel free to go left or straight. Which is a real difference. Like the civil code just tells you what you can do, whereas the criminal code and the rest of, I'm using the wrong terms now, but the Napoleonic versus.
Sure.
It says what you can't do, and this is a real difference. So we have slightly different legal foundations. And what if we told landowners that they didn't just have rights, they also had responsibilities. And if you're leaving your building empty and somebody else is going to make better use of it, well, too bad. You should have done something with your building. The beautiful Empress. And this is actually a strategy. It's well documented by Heritage Montreal of demolition by neglect. So we're very good at coming up with heritage policies, adding things, lovely buildings, intangible heritage, the 80 bus is part of our intangible heritage. Okay. But then, so if you buy a heritage building, because it's a great location, let's say at the corner of Van Horn and Saint Laurent, a former refrigerated warehouse with an iconic water tower on it or something. Just as an example. Then if you wanted to do something with it, it'd be very difficult because it's a heritage building. But if you just let it sit there for 10 years and then it becomes dangerous, then the firefighters come in and they say, hey, you can't, this is a real problem. You're going to have to knock it down. It's a public health hazard. Oh, too bad, But that was, you're playing the long game. Your investment is paid off. All of a sudden you can put your boutique hotel or whatever dumb thing that you're putting there. Yeah, exactly. So this is a real strategy of just demolition by neglect.
Adversarial, what was it?
Possession.
Possession. Adversarial possession. I like that term.
Let's bring it back. More spots.
Yeah.
I got a tent. I got a sleeping bag.
Sure.
It'd be fun. It'd be an adventure.
What kind of resistance do you think that would
the last squads that Montreal had were in the late 90s, I think, and they got crushed. There was an old hospital for a contagious disease. Montreal has a real history of pandemics. Of course, and there are several hospitals that were built just for the various measles outbreaks. And it was out east. Okay, I don't remember all the details because I was a teenager at the time, but I remember that within just a few days, everybody was kicked out, unfortunately. And then even in more recent history, 10 years ago, there was a series of encampments that the Frappru did, not even in buildings, just on public lands with tents. And they got chased all over town. They kept trying to pop up in different places. Finally, they went on a provincial land, the empty building that's at Pine and Saint Denis. Used to be a beautiful school, I believe. Anyway, public health was housed there for a while. And then the province kicked them out as well. So even, the squats don't actually have a great history in Montreal. But, recent history. But before that, there was the Overdale squat on Overdale Street, just up from Lucien Lallier, down from René Lévesque. And this actually happened to be in a heritage building. The squat saved that building from an ugly development project. And now that it's a heritage building because a prime minister grew up there, I forget which one. And now it's been all fixed up, and it's actually very nice. So the squatters actually served the overall history of Montreal and heritage of Montreal. Yeah.
Fascinating. Well, I mean, yeah. Because I'm always thinking about that.
And in Milton Park, there are many squats. That was part of the pressure when the developer bought up all these lovely old triplexes around the McGill University.
Right. They wanted to sort of extend downtown.
Exactly. Knock down all these old houses. They're unsightly. Let's put up beautiful gleaming towers, a city in the sky kind of thing. Bring downtown to the mountain. It was like, we're going to bring the towers to the mountain.
Kind of already there.
And, there are a few, but much of it was forced to go underground. That's why La Cité Mall goes like 5 stories underground because they were forced to hide it because there was such pushback. And squats, they just literally could not knock the building down because there were students living in them. So I take it back. There is a good history of squats in Montreal, and somebody should do a show about it. You should commission somebody to do a history of squats in Montreal.
There's actually a real it's so interesting to hear about this because this is kind of the unsung history of like the city, right? That really I find like does not really break through, at least the main kind of networks when people think about like history of Montreal, its preservation, and these forces that sort of shape it, right?
And the characters, right? The
Cadelles.
The Cadelles. Like he just sees himself as one of a long line of these like big powerful males, but mayors who are all men also.
I was going to say that's still true.
Exactly. But where is the people's history of Montreal? I feel like I think there have been some artists like Norman Narwaki and Frida Gutman who've done a bit of work around that, but I'd love to see more. People's history of Montreal. Make it happen.
Yeah. I would love that. I love the sound of that. I mean, it's already. I feel like I've learned so much more about our city through you and like these kinds of histories that you're aware of.
Well, interestingly, Montreal wasn't even founded as like a city of commerce. Trois-Rivières was supposed to be the city of commerce. Quebec City. Montreal was founded by visionaries. Like literally they had religious visions and they were like, we need to make a city to the glory of the Virgin Mary where people can just like live holy lives of prayer and like the dirty commerce, Trois-Rivières can take care of that. It's
going to be a holy place.
Exactly.
A spiritual place.
A spiritual city on a hill. And in any case, what if we got back to that? Wouldn't that be interesting?
Yeah. Send the commerce to Trois-Rivières, I think, first up. Send all the commerce to Trois-Rivières. Here, us and God.
There you go. We're just praying all day.
Yeah. I always joke about. I'm like, we got the cross up there.
Yeah.
Let's throw some other kind of religious icons up there.
Sure.
I mean, I guess it floods our.
Get an elephant.
Yeah. Boom, elephant up there.
Actually, there's a nice one in front of the temple on.
I'm sure.
Hutchison.
Yeah. Of course,
sure move it over there.
I'm sure there is.
Paint it some bright colors.
Okay. If I'm ever in Parc-Ex, do you have any spots?
Come to Parc-Ex. Oh my god.
Any restaurants you recommend?
All of them? Are you kidding? Yes, we could do like a walk-in.
I never know which one to pick because there's so many of them. Right?
They're all good. They're all good. And there's a lot of competition, which tends to drive down prices. And I wouldn't say it increases quality, but at least the prices are low. It actually increases the exploitation of the workers, unfortunately. But there's a lot of undercutting, but also a lot of avoiding food waste. I'm going to put that nicely.
Okay.
Using ingredients that are maybe a little bit passé date, but saving them from the dumpster. Parc-Ex is all about it. Yesterday, I was able to pick up a neighbor called. She's like, she's like, just come meet me, bring a bag. I was like, okay. And she's like, okay, I got this frozen eggplant that she'd found somewhere and a bunch of like frozen cherry tomatoes and some spaghetti squash. But it was frozen and like it was in a dumpster somewhere. So she gives me this food. I made the best spaghetti squash with tomato sauce on it. Ooh. Oh, my kids just pouring the Parmesan. They loved it. It was great.
Nice.
Yeah. Cost me like $1 for Parmesan. That was it.
That means a lot, especially when grocery prices are so high.
Of course. So Parc-Ex is really like we've been across the 40 from Marché Central, which is the big wholesaler. People come with the Super C's like, okay, give me 20 cases of your oranges or whatever. Right. The nice ones. But then the case of oranges that's quality B, quality C, a little soft, a little dodgy. That's where the Parc-Ex shopkeepers come in. Exactly. Yeah. And then sell it to you. So basically I'm buying food like every day on my way home, and it's relatively cheap compared to Whitehorse, at least, and the rest of Canada.
I mean, that's you always see every now and then there's a trending image of like grocery store prices up north, and it's just like $20 orange juice. And of course, that has to do with like how much it
$9 mangoes. I didn't have mangoes for a year, and then I came back to Parc-Extension. I was eating mangoes every day. I still love mangoes. Anyway, so we're just constantly buying food, but then cooking it right away and saving it we're like the end of the food chain. Right. And yet there's still hungry people. So that tells you something about the poverty in Parc-Extension. Do you know, I was writing a grant proposal last night and stayed up late, but Parc-Ex has the highest proportion of full-time workers who are nonetheless under the poverty line. It's 4 out of 10 workers in Parc-Ex are working full-time and still under the poverty line. It's just...
That's terrible. Yeah. Awful, yeah. I mean, that's something I've heard about from friends who work for like community centers or different community groups across the city. They're talking about like the type of person who visits these kinds of food banks is changing. Before it used to be certain like, I don't know, like certain kind of people who are not able to get jobs. Now it's even people with jobs, right, who have to visit just because of the prices are so exorbitant and high. Yeah. But I'm happy to hear people in Parc-Ex are getting frugal. They're getting creative. And
well, we've always been frugal, but it's
I'm happy to hear there's
avoiding the food waste because there's so much waste too.
No, of course.
Are you kidding? Cohesion? 110 proud years of being a working class immigrant neighborhood that relies on ourselves.
And so Jay Baruchel went to school in Parc-Ex, or
no?
Went to the
downtown. We went to a fine arts high school. Face.
Oh, Face.
You know Face?
Of course, I know Face. My joke is always like, if you went to Face, I'm stealing something out of your house.
What? You come, there's nothing.
Yeah.
You have a magazine.
Actually, no. You brought this magazine for a reason.
I brought a magazine. So this is interesting. So one time I gave a talk for them, and then they gave me like a free subscription that they haven't canceled yet.
So I am holding a magazine for our audio listeners. I'm holding a magazine. It says Droit et liberté. Imaginez une ville des droits humains. So rights and liberties. Imagine a city
of human rights.
Of human rights.
Yeah.
Beautiful magazine. Tell me about this.
Well, there are all these rights that Canada's a signatory to that we kind of forget about. Like we know about general human rights. Okay, the Convention of the Right of the Child. So these are mostly UN and UN agencies. So children have a right to a name and to an education and to not be put as child soldiers. Kind of basic stuff. Humans have a right to a passport in Canada and to not be thrown into jail without due process. So these are kind of like international rights, pretty standard stuff. We know about rights during wartime for war criminals, but then also for for prisoners of war. But then there's also like the Convention on Economic and Social and Cultural Rights, which states that there's a right to housing, and Canada's a signatory to this. And yet, what does that mean to have a right to housing? Because there's so many unhoused people in Montreal. So
many homes.
Well, exactly. So how do you rights only they exist on paper and then they're great, but they only become rights when you can operationalize it. If you can't actually have that right respected, it's not a right. It's like a tree falling in forest and nobody can hear it. So how do we actually get the federal government to follow through on these commitments? And then I think this issue is also talking about how would we get municipal governments perhaps to look at what rights you might have municipally. For example, housing, for example, the environment, just starting from the basis of the right to a clean environment, which is another right that Canada is a signatory to, but then doesn't get operationalized. I mean, that is just like a game changer. What if you had a right to green space, to clean air, to quality housing, to education, to not being stopped and bothered by the police all the time just because of the color of your skin? Like there are so many rights that would be interesting to see played out on a municipal level. What about a right to mobility? What about these are just a few examples off the top of my head.
Right. I guess how do you imagine? I keep saying right. That's kind of makes me laugh. But how do you imagine these things sort of being enforced? Like, do you imagine like groups are like, so we have these rights that the government has signed on to, but we actually don't have access to them. And so is it like the city? Would you say the cities infringing on your rights? Would you say the provinces?
So I think we have seen some cases of young people in North America in different jurisdictions. I think a group just won a case in the Western United States. I forget which one, maybe Michigan, taking their governments to court, saying we had a right to a clean environment and you're infringing on it. And these are cases that are actually going forward, which is really interesting because that's an interesting idea that you have a right to a future,
Right.
which is what these young people are saying. So usually it does pass through the courts where you have to say my right is not being respected.
If the government's signing on to this, and the courts like the government signed on to
Well,
it.
exactly,
Yeah.
exactly. And then we could also expand the rights, and we could give the rights to heritage buildings. We can give rights to rivers. We can give rights to trees. We could make lawmakers take into account those rights every time they authorize the filling in of wetlands for some terrible electric car battery plant down in the South Shore. What if every time we dam a river, even though we don't really need the electricity, we just want to sell it to New York State. What if that river had rights?
There's so many
how would we
opportunities then
respect
with
it?
this kind of framing.
Well, kind of, yeah. I have to admit, I'm really, really into rights.
Yeah.
I look forward to doing more reading. Not an expert, not a lawyer, but
Something
curious.
This passion you have, you see a lot of opportunities here.
Yes. Because I have to admit, before I think I was more like theoretical and maybe just like political campaigns, broad ideas. But actually, the anchoring it in rights means that even if you pass a law, like here's an interesting example. There's no right to an abortion in Canada. Right, it's considered.
People talk about that being sort of something that protects Canadians because it's not.
Right. It's considered healthcare. Right. It's just like, well, you don't. Right. Yeah, you don't have
it's on my mind too now.
A right to have a corneal surgery, or an appendectomy. So why would you? But some people say, oh no, there really should be a right. But then as soon as there should be a law saying you have a right to an abortion. But then other groups, especially pro-choice groups, say, hang on, if you do that, then any government that comes in can say, well, that's just a law. Now we have a majority, and so we're going to undo that law. And so all of a sudden you lose that right. So charters of rights and freedoms go deeper than just the transitory government in power who can pass laws. They have to respect. And I think Harper ran up against this a lot, where many of his dumb ideas were undone by the Supreme Court because it simply went against the Charter of Rights and Freedoms.
Right.
Thank goodness we have the Charter of Rights and Freedoms.
That's like the ultimate sort of document we have.
Well, in Canada, yes.
Of course, yeah. Fascinating. Anything else you want to talk
Reminder that I am not a lawyer.
Of course. No, this you cannot ask Sasha for legal opinion, but you can get a measles shot, a lovely tour of Parc-Ex.
Oh, yeah. And some food.
And some food.
I probably didn't pay for it, and it might be a little dodgy. No, I'm joking.
I'm like, huh?
I love free food. Yeah.
Actually, no. Before we end things, I kind of want to ask. So you're saying we have all these elections coming up, right? And we have like Projet Montreal, Ensemble, which are sort of searching for the leaders. You have the federal. I mean, your MP who has stepped down, likely to be replaced by someone else, and then provincial elections where the governing CAC is looking to potentially lose. So I feel like this is a kind of time of very open opportunity, right? Things could of course swing like anywhere. Like they could swing terribly, they could swing less terribly. But I'm kind of wondering what sort of future you're imagining for Parc-Ex, or what kind of changes you'd like to see there, especially through your work, but then also just being a resident and a citizen there.
Do you know, Calden, I'm not going to cry. Let's start with that. But
it's okay if you do.
I have a vision. One time I woke up one of these, vivid dreams, and I don't usually remember my dreams, but this one, I had been on Curbs Avenue, my old street, and there were no cars, and we closed off the street. We put tables down the middle, and there was food for everybody. We just had a big old meal, and that's, in my heart of hearts, that's my vision for Parc-Extension. Let's come together, let's take the streets, and let's share what we have. Because we know there's enough food for everybody. We know there's enough housing for everybody. We know there are enough jobs for everybody. It's just not distributed fairly. And I would love for Parc-Ex to be a model. In many ways, it already is. And it reminds me of the Myland I grew up with, where people shared freely, and it wasn't... money never exchanged hands, but we were constantly in each other's lives.
There's a different value set to the...
Different value set, and Parc-Ex is old school that way, and I love it, and I want it for my daughters, and I enjoy it so much. So I think in some ways Parc-Ex can be an example to the rest of Montreal, really how to live outside of capitalism and resist it as much as possible. Spaghetti squash. And we grow so much in the alleys, man, freaking lemons growing in Parc-Ex. Like, it's wild. It's so green. Considering how gray it is, how much asphalt there is, the alleys are so green. People have the tubs of feta, that once you eat all the cheese and you can plant in the tubs, the mustard oil containers, like everybody's growing their peppers. It's a lush place, and everybody's sharing, constantly sharing with our neighbors. I mean, they've never given us $1, except when the kids go caroling at Christmas, and then the old Greeks give them money, and I'm like, you don't need to do this. No, like, no, Happy New Year. But other than that, no exchange of money. So, my vision is that we continue to put together our lutte commune, our common struggles, and put pressure where we can. And elections give us a tremendous opportunity to go and squeeze candidates for commitments. And so I look forward to an interesting couple of years.
Yeah, a lot of squeezing, a lot of opportunities to squeeze coming up. I think that's we're approaching our time right now. Thank you so much, Sasha. For
Such a pleasure.
This is so nice. I feel like I just learned so much more about our city. I'm sure our viewers did as well. Thank you very much, everyone, for listening. This was Sasha Dyck, a public health nurse in Parc-Extension. Reach out to him for measles shots and food recommendations and maybe some spaghetti squash if there's a lot. Thank you very much.
Thank you.
Take care, everyone.